Man who spent his life fighting for the freedom to choose life is Ron Paul. He is a medical doctor by training and a congressman by the will of the voters. Congressman Paul joining us now. Great to see you, Congressman. Thanks for being here.
Thank you, David. Good to be with you.
You know, I don't get your views very often as a physician on this. You've got wonderful views as a libertarian on this issue. What do you think about what happened last night as a doctor?
Well, I think it's going to ruin the doctor-patient relationship. It's already been severely undermined because doctors don't deal with patients. They deal with insurance companies and the government, drug companies, and the whole work. So this just makes it that much worse. It's not all at once. It's been coming this way a long time because when I practiced medicine in the 60s and the 70s, before I came to Congress, I refused to deal with third parties. If they were on Medicaid or Medicaid, if they collected the money from the government, that was okay. But I consider something very, very important in medicine, and that is the doctor-patient relationship. And we should not be taking orders from somebody else. And yet today, it's very bureaucratic, and this bill is going to make it much, much worse, which means the patients are going to be less happy, the doctors will be less satisfied. Most people think people go into medicine only for the money. But I'll tell you what, a lot of us enjoy the fact that we can deal with our patients, and the bureaucracy ruins that, and I'm afraid this will make it much worse.
And it's any bureau. You know, I remember very clearly when I was a kid, the doctor coming for house calls, my father walking the doctor to the door, pulling out his wallet, giving the doctor a $10 bill or a $20 bill, whatever it was. Now, that's in the past. You can't go back to the past, but wherever you can get closer to that ideal that we used to live by, the better, as far as I'm concerned. What about you?
Well, of course, and you know, ironically, a little bit of that is coming back because some of the doctors who refuse to participate and opt out, those who are still doing family medicine, will go out and make house calls and take appointments and just charge $35. And they don't do any insurance, any bureaucracy. They don't carry any malpractice insurance. The whole works, and the patients are happy with it. But that's just far and in between because you need a hospital, you know, deliver babies and do surgery. You have to be in the hospital, so that drags you into the system.
Right.
You know, during this debate, they talked a whole lot about the public option. I just wish they would protect the private option.
Exactly.
Give us a chance to have it private. Just like you should have a chance to have private education, homeschooling. You should always protect that in spite of the disaster in public education. But if you always had a private option in medicine, some of us could survive, and at least we could set an example for the type of medicine that the people should be getting.
But now the private option, as you described it, and as we both, I think a lot of Americans wanted to return, it's going to be illegal. And not only will it be illegal because everybody will be forced to buy insurance, but you're going to have an IRS agent on your tail if you dare not to have insurance. What do you think of that?
Yeah, well, this is horrible because the people who are going to get charged are the ones who might not have carried insurance on purpose or would have had a major medical policy and they didn't want a big insurance policy. Insurance policy should be variable, you know, just like we buy for our houses and our car. We look at what kind of coverage we want. In medicine now, the people who need the least and would carry the least amount of insurance will be the ones who will have to pay the maximum, and they're the ones who will be hounded by the IRS. So this is a command society now, and medicine is right in the forefront of this. And I think symbolically, if the American people didn't have concern, they ought to just think about it. 16,500 armed bureaucrats coming to make this program work. If it was a good program and everybody liked it, you wouldn't need 16,500 thugs coming with their guns and putting you in jail if you didn't follow all the rules.
Exactly. I think you just said it. If it was a good program, you wouldn't need coercion. This is a coercion, using the power of the state as a coercive body rather than as a representative of the American people's will. There's something deeply, deeply wrong with that.
Well, it came about because the people generally in this country have lost confidence in freedom. Freedom really works and is very popular, but it lost its appeal because people became too dependent on government. And as long as we were wealthy and able to borrow a lot of